I'm entering the patient's room, knock, knock. Close the door for privacy, wash my hands. Hi, my name is Sarah. I'm going to be your nurse for today. Can you please verify your name and date of birth for me? Boy Dubois, 4:30. Okay, do you have any allergies, Mr. Dubois? He states yes, he is allergic to shellfish, and he does have an allergy band on to verify. I'm going to check the MR number. 772-7893, 772-7893, and they do match. Okay, Mr. Dubois, I am going to be performing a full head-to-toe assessment on you today. If you have any questions during the assessment, just let me know. I'm going to start off with some vital signs. So here on my monitor, I have a blood pressure of 129/76. Heart rate is 93. I have an O2 sat of 96% on room air. I'm going to put this under your tongue to get your temperature. It's 99.4. And I'm going to take your respirations for 30 seconds. And 30 seconds has passed. His respiration is 22. Are you experiencing any pain today, Mr. Dubois? He states yes. So on a scale from 1 to 10, how would you rate your pain? He states 3 out of 10. Where is your pain located? He states his right hip. Can you describe that pain for me? States that's sharp. Does it radiate anywhere? It's non-radiating. What makes it worse? He says it's worse with movement, but pain meds does make it a little bit better, and he could get a little something extra. Okay, and I forgot to ask you, Mr. Dubois, what is your reaction to your shellfish allergy? And he states that he does break out in hives. Okay, do you know where you are today, Mr. Dubois? He states that he is at Fortis Hospital. Do you know what date it is today? He states that it is May 28th. And do you know why you're here? Because he just got hip surgery. Yes, so give your pen, Lee. I'm going to shine this in your eyes. Okay, and follow the light for me. Good. So pupils are equal, round, and reactive to light, and they are also able to accommodate. Okay, I'm going to shine this in your mouth, stick it in your tongue. Oral mucosa is pink, moist, and intact. Okay, so I'm going to check for skin tenting, and your skin is non-tenting. Okay. Mr. Dubois, have you had a cough? He states that he has had a cough. Are you able to cough up anything? He says yes, so it is productive. And what is the color and consistency of that? He says that it's white and thin, and it is also clear. And about how much do you think you could cough up? And he states 5 milliliters. Okay, so I'm gonna listen to 8 places on the front and then 10 places on the back as well. Okay, so respirations are even and unlabored. They are regular, and I do hear a little bit of fine crackles in the lower lobes of his lungs. And I would listen to 10 places on the back and find the same findings as well. Okay, so I'm going to take a listen to your heart, starting with the second intercostal space to the right, which is the aortic. S1, S2. Second intercostal space to the left, pulmonic. S1, S2. Third intercostal space to the left is Erb's point, S1, S2. Fourth intercostal space to the left is tricuspid, S1, S2. Fifth intercostal space, midclavicular line, is the mitral, S1, S2. And I'll flip this over and listen for a full minute for the apical pulse. And a full minute has passed, and the apical pulse is 92 beats per minute, and it is regular. Okay, so I'm going to feel for your pulses, starting with the brachial pulse on both sides. and is +2 and regular. Radial pulse on both sides is +2 and regular. Going to check capillary refill on both sides. That is less than 3 seconds. Okay, can you squeeze my hands for me? Push down and pull up. Okay, perfect. Strength on the bilateral upper extremity is +5. Okay, when was your last bowel movement, Mr. Dubois? He doesn't remember, but can you tell me what the color was? He said it was brown. The consistency said it was formed. Was there any unusual odor? He states no. And what was the size of that? He states that it was medium in size. Okay, so I'm going to inspect the abdomen. The abdomen is non-protruding and it is flat. I'm going to auscultate starting in the lower right quadrant. Bowel sounds are active. Upper right quadrant, bowel sounds are active. Upper left quadrant, bowel sounds are active. Lower left quadrant, bowel sounds are active. Okay, so I'm going to palpate in those 4 quadrants as well. Can you tell me if you have any pain or tenderness? Lower right quadrant, no. Upper right quadrant, no. Upper left and lower left. The patient denies any pain or tenderness when palpating. Okay, can you tell me when the last time that you used the bathroom? He said way before my surgery. Okay, and what was the color? States that it was yellow. Was there any unusual odor? And he states no. The clarity, he states, was clear. Did you experience any pain, urgency, or frequency? And he states that there was a decrease in frequency. Okay, so now I'm going to just lift up the patient's gown and assess his genitalia. There are no lesions, edema, abnormalities, discharge, or sores present. So I'm going to put the gown back down. I'm going to come down to the legs and check for edema, which there is no edema present. His skin is warm to touch, it's dry, color is appropriate to ethnicity, there's no lesions or presence of breakdown. Okay, so I'm going to wash my hands and put on gloves. Okay. I'm going to first start by checking the dorsalis pedis pulse on both sides, which is +2 and regular. Posterior tibialis is +2 and regular. I'm going to check the capillary refill on both sides, which is +2 and regular. Can you push down for me and pull up? Okay, perfect. And the strength is a 5 out of 5 on the left side and a 4 out of 5 on the right side. I'm going to take my gloves off, wash my hands, and I'm going to inspect the chest for symmetry, and it does rise symmetrically. Okay, Mr. Dubois, I'm all finished with my head to toe assessment. Is there anything else I can get you? He states no. Okay, I'm going to put the call bell in your hand. If you need anything, just ring that. I'm going to put the bed down in the lowest position, the rails up, and I'm going to wash my hands and exit the room.